All right, well, good afternoon, everybody. This is Wendy Nas at COSSA. Welcome to this month's COSSA headlines. We have a really interesting deep dive topic for you today. And so here just quickly is what we plan to cover. As we do with each monthly headlines, we'll go over some of the most, what we think, notable news happening relative to the social and behavioral science policy and funding world. And then we will have a different kind of deep dive today. We'll have a conversation with Natalie Dean, moderated by Ron Wasserstein of the American Statistical Association, sort of continuing the series we started last month about all things COVID-19. Last month we heard from communication researchers talking about communicating in times of pandemic and sort of do's and don'ts, which was really incredibly useful. And this week we're going to go in a different direction and talk more about data and statistics. So stick around for that after we go through the headlines. And then of course every month we do like to provide some tangible things that you can do should you wish to be involved in COSSA or other community activities over the coming weeks. As always, you can use the chat box. I think we've all gotten pretty good at working remotely. But if there are any issues, feel free to unmute yourself. We can help you either ask your questions through the chat box or through the voice function as well. You can insert your questions at any time about any of the headlines, topics, news items, or for questions for Natalie and Ron, since this will be more of a moderated Q&A session as opposed to a formal presentation. But without further ado, let's go ahead and go through the headlines quickly. This month we're changing things up a little bit and having a separate slide on all things COVID, since that is the front of your mind. But we also do think it is incredibly important to make sure that our community is aware of other things that are happening, not specific to COVID. One example of that, for example, is firearm research funding out of NIH that we reported on last month, because these things could very easily, as you might think, be overlooked, just given all of the crazy happening around us with the pandemic. So first I'll go through some of the new things that we have going on or that we learned of related to COVID, but then we want to highlight some non-COVID things as well. Okay, so as I'm sure you know now, because it's everywhere in the news, Congress is continuing to work through supplemental funding for COVID-related things. The fourth package was passed at the end of April, and that was the Paycheck Protection Program and Healthcare Enhancement Act. This is, one that's a bit different from other supplementals that had additional appropriations for federal research agencies. This one was really focused on small business loans, healthcare provider support, additional testing, things like that. But hot off the presses is the introduction of a fifth supplemental. But this one, I think it's important to distinguish from the past supplementals that have been enacted into law. What was released earlier this week is a $3 trillion package written only by the House Democrats. And it's essentially their opening bid to future negotiations with the Republicans that probably won't happen until June. So if you're used to seeing news of supplemental additional funding bills in the trillions of dollars being enacted very quickly, and money coming to the states and federal agencies, that's not happening with this fifth supplemental. It's not expected to pass the Senate, although it'll probably pass the House tomorrow. So it won't become law. But the idea here is the Democrats have put everything that they would sort of wish for, sky's the limit, and do a $3 trillion, the largest so far, package that includes all sorts of things, from sort of more direct payments to families, individuals, more small business loans, aid to states, unemployment insurance extensions, and food assistance, and all of the things that you might expect. But in addition, it does include additional funding for research agencies. And while this bill won't become law I think it is important to keep an eye on the various provisions that are in it, because the Democrats will certainly use this as a negotiation tool with the Republicans in a couple of weeks. And so we will, as a community, want to continue to push on the supports for federal science agencies, for universities, and so on. So just to give you a sense of what's in that fifth Democratic package, there's about $3 billion in additional funding for NIH. But a little more than $3 billion. But what's interesting is that unlike past funding to NIH, where the focus was really on funding research to understand COVID and to develop vaccines and things like that, $3 billion would be for offsetting costs related to the reduction of lab production. So if this is Congress starting to hear about, okay, once we get past the need to actually research COVID and come up with remedies and cures and vaccines and things, there are all of these other impacts that are happening to labs and shutting down research projects and animal facilities. And so there is language in the Democrats' bill recognizing that this is a concern and money provided for that. In addition, there would be additional funding to NSF. About 125 million is what the Democrats are proposing. That's compared to 76 million that was already provided to NSF. So I think this is very welcome that NSF would receive more than it's received so far, just given the scope, again, of things happening with canceled research projects and fellowship programs and things like that. Also interesting, though, is that there's language in the bill that would dedicate $1 million for the study of the spread of disinformation related to COVID-19. The social, behavioral, and economic sciences are actually getting a lot of really positive attention at NSF right now. It's kind of our moment. We've been, as a community, begging, policymakers, federal agencies, White Houses, even leaders of NSF itself to pay attention to the social sciences. And now there's this deep recognition that our scientists have something important to say about this crisis. So very interesting to see certainly this interest in studying disinformation, but also to see going forward where the investments are going to be, because I suspect we will see a lot more support for social science related to the pandemic. But it remains to be seen, of course, if that will parlay in the future to more general support for social, behavioral, and economic sciences research across all sort of areas of study. And then finally, the Democratic bill includes some language related to the census as well, about sort of flexibility in the timing of census tabulations. And also interesting language about preventing the census from releasing administratively collected citizenship data with the 2020 count. And obviously the citizenship question has been a hot one over the last couple of years. And so this is the Democrats' way of saying, even, the administration has said, well, we can still collect citizenship information. We'll just do it through administrative data. But this is the Democrats sort of putting some limitations on that as well. So again, not going to become law, but it's sort of a really big menu of things that the Democrats will probably pull from as they negotiate going forward. And so we will be keeping our eye on it. And I wanted to just highlight for you some of the really interesting bits that are included in that latest package. Okay, a couple other news items, much quicker. Many associations, including COSSA and many of yours, have signed on to sort of this ask of Congress in the amount of $26 billion. Essentially, there are, the higher ed associations, AAU, APLU, AAMC, the medical colleges, have sort of come together and created an ask for $26 billion for federal research agencies, and it goes for a variety of things. It's support for extramural research grants, it's support for labs and animal facilities and other sort of pains that that research the research community is feeling. And so as a result of that, and a lot of our organizations signing on in support of that ask, there have been some Dear Colleague letters circulated in the House and the Senate. These are basically members of Congress writing to their colleagues in the House and Senate saying, we too support $26 billion for these purposes. And we have those letters on our website so that you can see if your members of Congress have signed, and if so, you might shoot them an email and thank them for that. But it's just worth mentioning because these were bipartisan letters in support of a lot of the things that the community is asking for right now related to supplemental funding. I wanted to flag those letters, and you can check them out online. Also really interesting is the development of a sort of a new network of experts to help policymakers get the scientific information they need in real time. So the NSF and the National Academies have created very quickly a Societal Experts Action Network, being called SEAN for short, which is really meant to connect researchers with decision makers at federal, state, local levels, and to give them answers to their most pressing questions. So this is different than a normal sort of National Academies activity where there's a general issue studied and recommendations may be created as part of that. But instead, sort of work groups will be formed as questions come in from policymakers, and the experts on those issues will be assembled, and they will come up with real quick, timely, but credible answers to those questions. So this is a really neat activity that's just getting started. And as more information becomes available, we'll certainly share it because we'll want to make this resource known to policymakers that they can get the information that they need. Okay, in other census COVID-related news, so the Census Bureau has applied for and received emergency authorization from the White House, from the Office of Management and Budget, to conduct a new household survey to collect information about the impacts of the pandemic on American families. The survey will ask individuals about their employment status and spending patterns and food security, housing, health, physical and mental, access to healthcare, education, and so on. And it's really been developed from input from agencies across the government, which is really great, including USDA and the Bureau of Labor Statistics and National Center for Health Statistics. So we're looking forward to seeing this. I mean, we see lots of different surveys popping up, you know, across the country from great labs and research institutions. I think, you know, 6 months, a year, 2 years from now, it'll be really interesting to see how all of this shakes out. So having sort of the full force of the census behind this activity as well is really helpful and exciting. Data collection will begin began in April and will continue for 90 days. And they'll be releasing data weekly. We have the link on our website as well, so you can check that out, but that's an exciting development. Many of you might be aware of the Golden Goose Award, which is sort of this annual activity where research is recognized that may sound silly or obscure or odd, but ends up having a major impact in some way on society, whether it's health or economics or you know, the energy sector or whatever. And there's a usual sort of annual process for collecting Golden Goose nominations. But this year, not surprising, there's a focus on highlighting valuable COVID-19 research. So by May 22nd, they are looking for nominations for federally funded research that highlights the significant and demonstrable impact that the project or projects have had on responding to COVID-19. I believe they're also still collecting regular nominations for a typical Golden Goose Award, but I think this is a really important way to recognize the work that's already happening that's timely to today's crisis. So something to think about there if you know of some really important work being done that is in that should be recognized publicly. Certainly consider nominating. So we have a resource page on our website for all things COVID, which is just COSSA.org/COVID-19. But if you go to COSSA.org and you type in COVID-19 into the search box, you'll get everything that's been tagged. So you'll find additional things. All of the articles we've written for update will appear there. So check out for all the links to the things mentioned here and all of the other topics we've been covering. Check out that website. Okay, so like I said, we wanted to also just flag for you some things that are happening that are not necessarily only COVID related, although this first one kind of is. This week, many of you I think have probably seen just through media and social media that the Senate Health Committee held a hearing that featured Anthony Fauci and other administration officials talking about all things COVID and when it's safe to go back to work and back to school. It's a really interesting watch as far as congressional hearings go, but I would recommend it actually for folks who want to sort of learn from the experts on what's happening with this. We will be writing up something for an update for our next newsletter as well, but that was very interesting TV for sure. In the executive branch, the White House continues to make important appointments that are really important for our community. So PCAST is this sort of panel of experts that advises the White House on all things science and technology. And the NSB is the National Science Board that advises both the President and the National Science Foundation on its activities. And so recent appointments have been announced for both of those bodies. We're still waiting on additional nominations and appointments to be made and announced, especially because there are two social scientists, Bob Groves and James Jackson, who have been serving on the National Science Board, whose terms have ended and have not been renewed. And so we're waiting to see sort of if there's anyone else from the social and behavioral sciences who will be appointed to these really important bodies. But you can check out the folks, those who have been recently appointed are not from our community, but you can follow the link there and check out the bios for those who have been appointed. There's also a really interesting new collaboration at NSF on artificial intelligence working with Amazon. And this is all about fairness in artificial intelligence. And it's really seeking to support research on how to ensure fairness in AI and machine learning. And so part of the funding is coming from Amazon, but importantly, and this is pretty common when federal agencies partner with private sector, the company will not have a role in the award selection process itself, but NSF will handle those details. You can check out the link there to hear more about what they're looking for. But they're looking for topics such as, but could include others, designing fair artificial intelligence systems, ensuring transparency and accountability in AI systems, understanding factors that affect the integrity of algorithms, and so on. And the first round of proposals will be due in July. So check that out, and it's a brand new program. We have been reporting on the federal data strategy for a while now, as it's sort of a new and really positive thing that the government is doing to ensure sort of quality data and access to data, including privacy considerations. The strategy has released an update for the first quarter of 2020 on the implementation of its 2020 action plan, which we've reported on previously. The update includes a list of early milestones that the strategy has met so far, such as the establishment of a federal chief data officer council and federal data policy committee, all sort of new activities to police in some way, make sure that the federal data strategy is actually moving forward in positive ways. So check out more information there on the link. And then a few final updates about some things happening in the community. It's award nominating season. So AAAS has a whole series of awards and prizes that they make each year. And of course, we love it when we can have our community recognized for their work. So you can go to their website and nominate, check out the criteria and the various awards that AAAS has for recognizing exemplary research and mentorship as well. COPAFS is a sister organization of COSSA's specific to advocacy and support for federal statistics. And so we work closely with COPAFS, and they have just named a new executive director, Paul Schroeder, who begins, I think, at the end of this week. So we're excited to work with him and see what COPAFS has going on in the months ahead. And finally, a little bit about what we've been up to. Many of you participated in our Advocacy Day that took place at the end of April. It was virtual, as you might expect, but it was great. We had about 40 advocates have virtual scheduled appointments with congressional staff and several members of Congress themselves who got on the phone and talked about the issues with us. I wanted to mention this because so many groups are canceling their DC-based events, rightfully so, but you're not seeing too many be changed to virtual events when it comes to Hill advocacy. And I will just say this was an incredible experience. We didn't ask for anything in our meetings. Instead, we offered our community as a resource to the COVID pandemic response and relief. And the response from the Hill has been incredibly positive. Their congressional staff and members of Congress are hungry for information that they can trust and sources that they can rely on. And they really did seem to appreciate us coming in and asking how we can help them. So that's just the plug for if you have interest in helping policymakers right now and you have expertise that you can share, it is worth reaching out, and we can certainly help you get in touch with members of Congress and their staff if that's something that interests you. The appropriations process for non-COVID things continues. That is must-pass legislation. You hear about government shutdowns. That's if Congress doesn't pass their appropriations bills. So COSSA continues to go through the motions, submit testimony and our requests for fiscal year 21, and you can see the requests that we've made in our testimony that's posted to our website, just in case if you're wondering sort of what the community is asking for, not related to COVID, but for regular funding for NSF and NIH and census and so on. That is available online. And then finally, you should hopefully be receiving already, but if you're not, our Why Social Science monthly blog posts. This time we had a demographer write for us, and again, keeping with the COVID sort of timeliness topic, she wrote about the impact of the epidemic or the pandemic on minority communities and how sort of the disparities are exacerbated and institutional racism is exacerbated in times of pandemics such as this. A really interesting piece. And we're always looking for additional Why Social Science contributors across the disciplines, or especially folks from outside the social behavioral sciences who can speak to the value of it. So certainly share any ideas you have for us, but make sure that you are signed up to receive these pieces once a month, as they're incredibly useful, I think, in explaining to a lay public why our science is important. Okay, that was a quick tour through what is happening in Washington related to social behavioral science policy, funding, COVID, and so on. I don't see any questions in the chat box. I don't want to use up any more of Natalie and Ron's time. So if you have questions for me on any of these topics, you can put them in the chat box. We can answer them towards the end, or certainly shoot us an email. But I would like to move right on to our deep dive discussion. Here we are. Which is an epidemiologist answers your questions about studying a pandemic. I'll turn things over to Ron Wasserstein, who is the executive director of the American Statistical Association, and he sits on COSSA's board of directors and has very kindly offered to moderate the discussion with Dr. Dean, who is an integral member of the statistical community. So Ed, I will kick things over to you.
So thanks very much, Wendy, and it's my great pleasure this afternoon to introduce my colleague, Dr. Natalie Dean. Dr. Dean grew up just outside of Boston and is thoroughly Boston educated, having received her PhD in biostatistics from Harvard, her AM in biostatistics also from Harvard, and her BA in biology and mathematics statistics from Boston University. My Harvard affiliation, Natalie, consists of the fact that I own a Harvard hoodie. That's about it. She's an assistant professor in the Department of Biostatistics at the University of Florida. Before she joined the faculty there in 2017, she was a postdoc at Florida for a couple of years. And before that, she was an external consultant for the World Health Organization's HIV department. Dr. Dean's areas of research interest include public health surveillance, infectious disease epidemiology, emerging pathogens, vaccine evaluation, clinical trial design, and adaptive design. She has been a go-to person for helping the media and the public understand important aspects of this COVID-19 pandemic. Dr. Dean has been interviewed by Mary Louise Kelly, one of my heroes, on NPR, was featured in WBUR's On Point syndicated program, has written a New York Times op-ed along with Carl Bergstrom of the University of Washington about herd immunity, interviewed by the Miami Herald about issues related to Florida's reopening, and that's just a sample. Back when there was such a thing as free time, before there were small children and everything else that's going on right now, Dr. Dean enjoys cooking, Zumba, and someday again will enjoy travel, but obviously right now that's on hold for all kinds of reasons. So, Natalie, our COSSA Deep Dive listeners will have some questions for you, but let me just start with one of mine that goes to all that time that you've spent with the media. So, just broadly speaking, from your perspective, what do you think the media is getting right about its reporting of the pandemic, and what still needs to be improved?
Great. Well, thanks so much for having me. So, yeah, the media is a broad term, right? So I've interacted with a lot of reporters. Some have done a really good job, some not quite as good of a job. I think one of the big challenges is that in an emerging situation, there's a lot of uncertainty and there's just a lot of information. And often the answer to people's questions is, I don't know. And so the media struggles with the answer, I don't know, even if it's the real one. And so sometimes, occasionally there will be folks who will offer up an answer, but it's the folks that offer up an answer when the real answer is, I don't know, that it can be the most confusing to the public, because it may, people want answers, but the reality is there's a lot of uncertainty. So communicating uncertainty is a big challenge, and that's exacerbated by the fact that we have all these preprints, and research is emerging so quickly, and it's sort of going outside of the normal peer review process. So I think preprints are very valuable, but there's a lot the media can do to learn how to report on those better.
Thank you. Just to follow up on that slightly, so there's I don't know, because that's not my area of expertise, and there's I don't know because nobody else does either, and here's why. And I think that's where the interesting stories start to happen.
Yeah, exactly. I mean, the kids, the role of children right now is a big I don't know for everyone. I mean, I've seen competing evidence about whether kids are being infected at the same rate or whether they're infecting others at the same rate. And these are all very important questions, but I mean, the answer is still I don't know. Yeah.
So along the lines of I don't know, and remember participants to chime in on the chat box if you have questions. Along the lines of I don't know, what are you seeing with regards to the data that we need but don't have, and are we going to be able to get that data at this point?
Yeah, I think there are a lot of big questions. So I mentioned one, the role of children, and that's going to really impact a lot of policy decisions. We all want kids to be able to go back to school, but we need to understand both how they can circulate disease amongst themselves, and then also to their teachers or back to their family members. And I do think that we will have better answers to those questions for sure. We're going to understand more about the biology by tracking people over time. We can look at sort of the dynamics of the virus within people, and we can, and try and piece together some data from contact tracing. So are we seeing that kids are spreading to others, or are kids kind of a dead end where they get infected and then none of their family members subsequently get infected? So some of that can be sorted out with household data. But I was talking to someone recently about whether there should be, for some of the policy related questions about opening schools or opening universities, whether there should be some more randomized trials or, or rigorous studies, or these are really complicated questions. So those are, I don't know how studies are going to sort those out unless we really think carefully about what they would look like. Oh, you're still muted.
Yeah, thank you.
Okay.
And thanks for that answer. And we're going to have a question here from our one of our attendees. And maybe, Sandra, since I'm not quite sure I understand your question, do you want to go ahead and unmute and just go ahead and ask Natalie?
Okay, thank you. Do you hear me?
Yes.
Okay, thank you. I would say we're trying to track here. I'm in Iowa, and we're tracking cases and rates per 100,000 and so on. What might be some of the things you think might be most important that we should track? I'm thinking from the health medical virus standpoint, that we might be most interested in following from an epidemiological point of view.
Yeah, so I've sort of advocated for this. There's a measure that's been getting more traction, which is the percent of tests that are positive. So the only way to get that number low is to be testing a lot and to have the prevalence in the population prevalence of infection be fairly low. So that's something that I've been tracking. So what we want to see, the WHO at one point put in a benchmark of about 10%, but I think we probably want to see numbers quite a bit lower, more like 2 or 3%. So right now in the U.S., it's that number's going down, but it's still pretty high.
Okay.
So that's one, yeah. And then focusing on sort of vulnerable populations, like how good of a job are you doing keeping this out of nursing homes and things like that. Like, are you protecting the particular people that you're really trying the hardest to protect? Are you succeeding there? That would be another thing.
Thank you. Why, we have been able to do that because Iowa is publishing the number of tests that are done, and we can easily, get a percent rate. We could do that almost on a daily basis, but I've been looking at it sort of week to week. And we also have, you may have seen in the news on the meatpacking plants here in Iowa. So we've been trying to track some of those things too. But thank you very much. Thank you.
Thank you, Sandra, for that question. And I see that, Norman, you have your hand up. So go ahead and unmute and let us know what's on your mind.
Okay, thanks. I was concerned about tracking. I mean, in some sense, the notion of tracking, I'm sure, which is very well known to epidemiologists and so forth, has not been something that's been talked about before. And I've seen some incredible numbers about the number of people needed to do adequate tracking if we're going to go forward with much more opening up and so forth. And I was concerned about what kind of training are there for trackies? Are there manuals for models for what you do for tracking? It seems like it's something which is not well known, at least to me anyway, and I know a moderate amount about these sort of things. So is it kind of specialized field? Is it somebody who needs to be an epidemiologist? What all goes into finding, if you're going to have to hire 100,000 trackers or something like that, where are they going to come from?
Yeah, those are great questions. So about contact tracing, that one of the challenges with contact tracing, where you're tracking down the people who have been in touch with someone who's confirmed to be infected, the numbers don't scale very well. And so when you're at the peak of or when you have a lot of people in the community who are testing positive, it becomes hard to have the capacity to actually follow up with people in a timely enough manner that it will be impactful. But it's incredibly important. And so even though we didn't get the start we wanted early on, it's the hard work that we need both to bring numbers down and then also, once we're in a better place, to be able to keep things from flaring back up. So it's vitally important. I would like to see more attention paid to educating people about training people. And there's been a lot of talk about these digital strategies, but I don't think they're going to work quite as well, because really a lot of contact tracing is about engaging with an individual, helping them navigate their circumstances, figuring out how to get groceries, figuring out how to keep their family safe. So Johns Hopkins recently launched a free COSSA course that teaches people how to do contact tracing, but I think we're going to need to see a lot more attention paid to educational material here. So Partners in Health is doing a great job in the state of Massachusetts, and they're leveraging a lot of what they've learned from other diseases in resource limited settings where they've done tracing in the Democratic Republic of the Congo in the middle of in a war. And so if you can do that there, I really think people can make phone calls here, but the numbers are big, so we're going to need to start training up a lot of people. But more attention paid to how to actually educate people about how to do that, and also to convince people of the value of educating people, as a pillar of public health to keep people safe.
Thank you, Natalie. And Norman, thank you so much for your question. Natalie, we have another question through the chat box from Sandra. What would be the usefulness of doing random community testing rather than doing testing when someone has symptoms or thinks they've been exposed? And I'll just add onto that a question of my own that's related. That is to ask you what you think about the concept of group testing as a way to measure.
Yeah, that's great. That's something I'm very interested in as well. And so one of the big challenges with this particular virus is that we know that some fraction of transmission is occurring before people have symptoms. So there are some people who are asymptomatic, never have symptoms. That's probably rarer than we really think. But there are definitely some chunk of people who are transmitting before they have symptoms. So some estimates put it at about 40 to 50% of transmission is occurring from people without symptoms. So that makes it very challenging to rely on traditional tracing strategies that focus on isolating people who are symptomatic, acutely infected, and isolating them from the rest of the population. So, tracing can get some of their contacts, but they might already be infected. Maybe we can keep them from infecting others. But I do think there is a role for another strategy, which is universal testing. So that's testing people who are asymptomatic in some level in the general population. You can be smart about it. You can focus on healthcare workers. And so something like pool testing is a nice way to allow, people spit and then you combine the spit. And that's a nice way to allow you to do testing at more frequently at a scale. So if you can test people kind of every few days, then that can really help you identify those people before they transmit to others. And so New York State is now requiring that healthcare people working in nursing homes be tested, I think, twice a week. At the University of Florida, at our hospital, every inpatient, everyone who's coming in as an inpatient needs to be tested. So those types of things where you're testing people without symptoms, I think we'll need that in addition to the contact tracing.
Thank you, Natalie. So a lot of people on this call today have as one of their primary responsibilities trying to educate and influence on at the Capitol, at the White House, and so on. And so here's a question from my colleague Steve at the ASA. Actually, what would you advise scientific societies like members of COSSA, ASA, and others to be like the top messages that we should be trying to get to policymakers, or just things to help them understand?
Yeah, the most important thing is we're going to have to put in some hard work, but the stakes are really high. And so we have to put in the hard work to really scale up the testing, making sure it's getting to people. People are connected with the testing. Finding ways to make that easy for people sort of gets rolled into occupational settings or things like that. So we're going to have to do the hard work of scaling up testing and getting this tracing. I mean, these are cornerstones of public health, of infectious disease epidemiology. So but they're a lot of work. And so it's really important to do, though, because the alternatives are not really tenable. The alternative of not doing anything and just letting it spread is not tenable. And I think people maybe will have to come to that realization on their own timeline, but it's, so that would be, a big point. And then just educating the public, I think, understanding what are specific activities they can do that are lower risk, what, specific guidance about how to actually protect their families. And we're learning a lot more about the role of sort of being in close contact in indoor spaces and talking, extended conversation. Those are kind of higher risk activities, spreading through the respiratory droplets. So on the converse of that, finding the low risk activities to allow people to, keep doing, find safe ways to re-engage with the economy and with each other.
Thank you. That's extremely helpful. I'm going to follow up on that just a little bit. You mentioned two things that intrigued me, several, but two in particular. So hard work, and then you were talking about contact tracing in Norm's question. So related to both of those things is the idea of isolating the contacts, and then you have the contacts and you have the families of contacts, or you have the families of individuals who have contracted the disease, and thinking about how to do that kind of isolation. Now, as you know, in China, in Hubei province, they created facilities to isolate families when there was one person who contracted it. And so in that hard work department, what do you think might be workable strategies for for these kinds of isolations, I guess I should say? Yeah,
it's right. Not a solution that works somewhere else isn't going to necessarily work everywhere. People are not going to accept sort of centralized quarantine, a mandatory quarantine. But just because that version is not acceptable doesn't mean that there is not another version that could really help and work. So there are different approaches people are taking. Some are, universities and are opening up dormitories and hospital hotels, and all these vacant hotels, right? So some of them are opening up space, including for healthcare workers who may be working on the front lines and don't want to go home and worry about infecting their families and don't want to have to sleep in the garage or something, so making a more comfortable space for them if they have an at-risk family member at home. So and then also options for people who are known to have been exposed and may want a place to kind of wait out that 14-day period or something. They don't want to infect their families. And there are people who are going to take this resource if it is made available. I think it's going to be a lot in figuring out what that policy actually looks like. But we do know that it spreads quite easily within households just because you're together, especially if you're in a crowded household or you're living in close confines. So having these options, I think, will be really important for stopping that part of the puzzle, which is this household spread.
Thank you very much for that. I appreciate it. Let me switch gears just a little bit. So you started off working in HIV research, but in your training, you have also looked at the spread of other viruses like SARS or MERS, H1N1. Are there things that you feel like are lessons that you see from those previous experiences that translate into what we're dealing with?
Yeah, definitely. So, so HIV, for example, one thing we really learned is that viruses can spread in in marginalized populations for a while before they're detected by the healthcare system. So keeping an eye on, besides the fact that those populations are at higher risk due to crowding and other, maybe lack of, well, it depends on the country, but lack of running water, different challenges. So early intervention there can have a particularly large impact. So, a little extra surveillance in marginalized populations. From Ebola, the value of contact tracing and really, that. So I worked on a vaccine trial in Guinea in West Africa during the Ebola epidemic there. And, the fact that even in these really challenging circumstances that you can make things work, through creativity and innovation. There were mobile teams that went out, enrolled people in these trials, vaccinated people. So, that nothing's impossible. And then with MERS, I would say, we learned a lot. So Middle East Respiratory Syndrome is another coronavirus. It's different in ways. It's more severe. It doesn't spread as much pre-symptomatically, but it's related in the fact that there are certain activities that seem to spread a lot of virus. Like when people are intubated, we call those aerosolizing procedures. So those are trying to understand the particular settings where there is a lot of transmission and then intervening there.
Thanks for that. So we're having this conversation and you're doing what you've been doing for many weeks now, which is working from home. So how is that? How is, working from home, dealing with, social distancing and so on, affected how you do your research, how you do your job?
Honestly, there's been very little change for me. So, I actually was on maternity leave through early March. So, so I just had my second baby. So, so I was back at work for a few days before I had to come back home. So it was a different transition for me. I've just always been someone who's been able to work anywhere just based on what I do. So, so I'm probably the wrong person to ask, but yeah, just a lot of phone calls, reading things, and yeah, that's about it.
Well, thanks for that. And yet, maybe not the wrong person to ask because you're dealing with the things that a large part of the economy is dealing with in terms of, got to work at home, got to care for children, got to maybe homeschool children or just care for little ones, and it's a challenge. And so thanks for that response. We're COSSA, we're a social science association, obviously, and we advocate for the well-being of the social sciences. I wonder if you have some ideas about ways that the social science community might be more involved or better involved with regards to being part of the solution in this interesting day that we live.
Absolutely. I have a lot of ideas. So I don't know how you go about doing them, but I know the questions that I have where I'd really like a social scientist to chime in. So, really understanding, I think the tracing is one thing. So there seem to be barriers there. Anything we can do to make that process more efficient, getting people more likely to engage, figuring out better ways to support people as they're navigating their circumstances. What I saw an example in Fairfax County where they, their contact tracers are overwhelmed. So one thing they did is provide educational materials to people in the form of a mailer. And it basically said, if you come down with symptoms, write down when you come down with symptoms, what they were, who you've been in touch with. And then it also provided some information about how people could make phone calls to try and let folks know. Just, so empowering individuals to participate in the process, and the best way to do that. I see the issue of vaccination, understanding if there's going to be resistance to vaccination, or the questions about there. Always, how are we going to, hopefully at some point soon, not too long, we'll have a vaccine, and we can, how do we get that out to people in a way that's sort of acceptable and increases uptake? And I don't know. So that's a ways down the pipe, but just, those are some of the things that I'm thinking about. I'm sure there's more.
That's super helpful. And I know people on this call appreciate that as well. Gonna follow up on a specific aspect of your question and also your expertise, although this may be an I don't know question, and that's fine if it is. But everyone, of course, is hoping, eager to have a vaccine for this. But it's my understanding, and this is where this question may be totally wrong. We haven't really effectively developed a vaccine for any other coronavirus to this point, have we?
No. So I can explain a little bit there. So
Okay.
there are the mild coronaviruses, the common cold coronaviruses. Those don't elicit a very strong immune response. They're pretty mild. There hasn't been a market incentive to really develop a vaccine there. SARS and MERS, there were vaccines in the pipeline, and they were stopped for a number of reasons. The biggest one, so I was involved in discussions a few years ago about how would you advance candidates for these diseases. But, well, first of all, SARS, there's no SARS. So in order to assess whether a vaccine protects, so it's efficacious, you need to actually see in the field if it's protecting people from infection. So there's no SARS, so that's kind of a dead end. And then with MERS, the outbreaks are so sporadic, and they're primarily in Saudi Arabia from spillover from camels. But they're so sporadic that you would need like hundreds of thousands of participants. So, there have been, I think in vet medicine, they've been trying to develop a coronavirus vaccine for a while, and I think they have had some challenges, but I'm sure it has not been met with the same enthusiastic effort as is ongoing right now.
Thank you. That's super. That clears up something I've wondered about very well. Thank you.
Yeah.
So we're coming down the home stretch here. Maybe I'll just ask you one more question, then see if you have any kind of closing remark you might want to make. If you do, so you mentioned Fairfax County. That's where I'm sitting, and we're pretty cautious here about reopening. You're in Florida, where there's the state government has a different attitude about reopening. Definitely not trying to head in any sort of political direction here, but purely from the standpoint of your work as an infectious disease epidemiologist, do you see some states or cities whose efforts are maybe more impressive? Let's go on the positive side. Some areas that are maybe trying to do this right?
Yeah, I see. I mean, I mentioned Massachusetts is engaging with Partners in Health. And they're working closely to build up the tracing capacity. And there are more state governors who are contacting Partners in Health and want to engage in the same process. Yeah, I mean, there are states who are trying to follow the steps that have been laid out by experts. And, in the short term, it feels more painful because I think people want everything to go back to normal. But the reality is that if you don't follow an evidence-based guideline, I mean, just what we know about infectious diseases is they will start to take off again, circulate again. So we may get some reprieve with the warm weather. It's not, it's not quite clear the role of seasonality, but even if numbers are not, so high for the next few months, I mean, they can still go back up later. So, yeah, it's about this work in the short term that I really think will help pay off more in the long term, because you'll build up these systems that you'll need to be able to return to some level of functionality.
Thank you so much. Is there anything else that you'd like to share or comment on, or that's top of your mind right now?
Oh, I feel like
we worked over pretty good.
Yeah, well, I'd like to hear more from a social scientist. I don't know if there's a good way to get, maybe I'm just in a bubble. That's very possible. But I really think right now it's a lot of modeling and, virology, but clearly there's a very big human element to what is happening. And also we need good policies in order to really make any of this work. And so converting the science into good policies and evidence-based policy is really important. So I'd like to see more people in the conversation who are contributing that expertise.
Well, thanks. You're talking to the right group for that, for sure. Wendy, I'd like to kick this back over to you then.
Yeah, thank you. Thank you so much, both of you. And I think that's the most appropriate way to end this discussion with a sort of call to action to our community. And it's a good sort of bookend to what I was talking about with our advocacy day. I think the hunger for information, for trusted sources of information, of evidence, of not just, you know, advice, but advice backed up by evidence on what should be happening is exactly right. And it's what our firsthand experience has been too, just talking with policymakers. So thank you for that. And we will definitely think about ways that we can, as a community, continue to press on our community to speak up. Because we know we have things to say about this, but making sure that we're heard. So really appreciate both of you. And to all of you tuning in for your questions. If you have others that weren't answered, send them our way and we can see, you know, what we can do to continue the conversation. In the last just minute, I wanted to flag a couple of things that you can do if you want to stay active in COSSA related things. Certainly not on the list here necessarily, but answer Natalie's call for action and let us know if you want to be involved. If you have something to say about this, we can brainstorm with you how we can get information to the other sciences or to webinars or the media or policymakers. Tell your congresspeople that COVID-19 response and recovery should be based on sound science, including sound social science. We have an active action alert on our webpage right now that we hope you'll respond to and share with your colleagues. It's not asking for funding. Again, it's saying that social science has something important to say here, and we urge you policymakers to make policy based on that. If you have examples of research, data sets, survey instruments that you think are good examples, we have some really good one-pagers that we developed for our advocacy day that have stories about what social science says about social distancing, how it's helping small business sort of economics, how it's helping with sort of resource scarcity of PPE in medical settings. Anything like that that we can use to help tell the story, certainly share with us, but you can pull down some of those examples already on our COVID website. And then finally, a reminder about the Golden Goose Award nominations. They're due next week, and we really do love to see social science included among those being recognized because we know that you are doing important work. With that, we will remind you that we'll be back next month. We want to know what you'd like to hear about. We're going to continue, sadly, as long as COVID continues, to highlight ways that social science is helping address the current needs. And so if you have someone really notable from your discipline or field or association that you'd love to hear from or think would make a good deep dive topic, let us know, and we will get that lined up. And just a reminder that we do record these, and you can see all the topics that we've covered just over the last 12 or 14 months on all things social science, but more recently COVID and social science. So you can check out those recordings online. And with that, we will end with this slide, just reminding you to be engaged in COSSA activities, make sure you're receiving our materials, tune in each month. And of course, our work is 100% dependent on the support of our members, and we thank you for that. And so if there are associations, disciplines not represented, universities who you think would benefit from these types of conversations, please share that information with us. We'd love to include them in our community. And with that, we will end exactly at 3 o'clock. And I want to thank Natalie and Ron again for participating and for all of you for tuning in and sharing your thoughts with us. We hope you stay well, take care of yourselves, take care of those around you, and we will talk again in June. Take care.